Hi everyone. Today I'm going to talk to you quite briefly about some work we've been doing looking at incontinence in children in emergency settings. So particularly in Adjumani district in northern Uganda and in the Cox's Bazar refugee camps in Bangladesh. Self-wetting can be one of two things: urinary incontinence, which is the medical condition of the involuntary loss of urine that people can't physiologically control. Or you can also have social urinary incontinence, which is leakage because people don't want to or aren't able to use the sanitation facilities available. And we have seen both of those things in the children that we've worked with in these emergency contexts. So Eleanor's Humanitarian Innovation Fund put out a call a few years ago to better understand the experiences of people who live with incontinence in emergency settings. And they funded 3 different projects, and our one focused on children in the age group of 5 to 11. So we had 3 main aims. One was to develop a methodology that could be used to better understand the experiences of children who self-wet in these settings. One is to actually better understand these experiences in these 2 settings and see whether they could potentially be similar to what we're seeing in other places around the world. And the third was try to provide some guidance for better emergency programming practice. The basic premise of the methodology is that the children in focus groups co-create an imaginary hero, and then they explore that hero's feelings by drawing how they feel and how other people react to them during the day when they've wet themselves. So caregivers, teachers, other students, that kind of thing. So we're not trying to hear about the experience of that particular child, but more an understanding of what would happen in their setting to children who do self-wet. In terms of actual experiences, we're still writing the papers on these, but overall the things that we have seen are that children are quite distressed about self-wetting, whether that be urinary incontinence or social urinary incontinence. Parents often consider self-wetting a disease that needs treatment, and they seek help, and when it's not cured, they're very frustrated. It's a real emotional burden for parents because they're already trying to deal with the trauma of the emergency context they're in, and the children experiencing self-wetting just adds the things that they need to deal with. And we did see that quite often children were scared and were actually being punished, sometimes physically, when they wet the bed, for example. And then finally, just a very quick overview of the practical steps that we're recommending from this work. One is that we found the sanitation facilities available for children were really not appropriate. So not just the facilities themselves, but also the pathways to facilities and that kind of thing. So we're recommending that you look at the Child San framework, which Rosato-Scott, who was one of the lead researchers on this work, developed, which is a compilation of the best guidance for how to design emergency sanitation for children. We found that we really need to communicate to caregivers in particular that self-wetting is quite normal and most children will grow out of it. So definitely, if there is support available, you'd want to have access to it, but also supporting children is really important. And we've developed these posters that are available online. You can change the language if you'd like to change the message at the top to a local language. And you can also add at the bottom contact details for local organisations. We found that there is a need to provide more products that support living with self-wetting, so mattress protectors and pads, extra soap for washing, that kind of thing. And also that there's a need to train humanitarian staff on the realities of self-wetting and ways that they can support individuals. And we're currently working with the Research and Grants Institute of Ghana and Oxfam to develop this training program for humanitarian professionals that will be rolled out very soon. So if you check out this website, you can either view or go to links to download all of our formal project outputs, so the posters themselves, journal articles, that kind of thing. But you can also download the research tools if you would like to try using the storybook approach in your own work. Thank you very much.